is Rebecca Darby. I'm a student physical therapist assistant with Jeff State, and today I'll be talking about some treatment interventions for a patient with L5-S1 herniated disc. So all that means is the intervertebral disc between the L5 vertebrae and the S1 vertebrae has bulged out posteriorly, and that's causing pressure on the nerve roots that come out between those two vertebrae, which is causing symptoms in the patient's lumbar region as well as in a lower extremity. So it's been 3 weeks since this patient's injury. It was a week before they came to physical therapy, and then they have been in physical therapy for 2 weeks. There's now been a reevaluation done, and the treatments that I showed today will be based on the plan of care for the reevaluation of this patient. So 2 subjective measures that you want to be sure to reassess every session for this patient are the location of their symptoms, whether they're in the lumbar area or down into the lower extremities. You also want to assess any activities that may aggravate or relieve these symptoms. Objectively, 2 things that you want to reassess every session are their trunk range of motion, especially be sure to measure their trunk range of motion into flexion, bending forward. That's what causes this patient the most trouble, where they're the most limited, so you want to be sure to reassess that every session. You also want to perform the straight leg raise neural tension test every session. That's going to be a passive range of motion test into a straight leg raise. Okay, so the first intervention we're going to do today is a soft tissue mobilization technique. We're going to use elongation as well as muscle play to the right lumbar paraspinals. And so the first thing you want to do is just make sure you've got your patient draped appropriately to prevent any of the lotion from getting on their clothing. You just want to expose the area that you're going to be treating. And then you just want to get a little bit of lotion, and we're going to be focusing on the right lumbar paraspinals over here. You just want to do some elongation. Start out with just try to get those muscles warmed up. And the reason that we're doing this is to try to increase the tissue extensibility in this area to improve the pain and mobility that this patient is having. Try to get some more mobility into flexion by loosening up these muscles. The objective measure that points to using this intervention is that upon palpation, the right lumbar paraspinal musculature had decreased mobility compared to the left lumbar paraspinal musculature. You can also use muscle play here, and with that you just want to grasp the muscle and you just want to kind of work it back and forth. Just trying to improve extensibility and relieve some tension in that area. The next treatment intervention that we'll be doing is a patient education activity. We're going to educate the patient on a proper lifting technique, and this is important for this patient because they have a job as a construction worker, so they're regularly required to lift objects at work, and they tend to bend their spine forward when they're lifting anything below the waist in an attempt to protect their knees. So we want to teach them how to properly lift things without bending their spine forward. So what you want to do when you're going to lift something is you want to bend at your hips and your knees, keeping your spine neutral, and squat down close to the object that you're going to lift. And you want to keep the object as close to you as you can, and grasp the object that you're going to get within the base of support that you have. Okay, so you want to keep a pretty wide base of support, grasp the object, and then use your legs to push up, keeping your spine neutral the whole time, okay? So get the object, use your legs to push up, keeping the object as close to you as you can, okay? Next intervention that we'll be doing is a home exercise for this patient. What we're going to do is something called a goblet squat, and we're going to use a 10-pound dumbbell. with that. The reason why we're doing this is to increase the patient's lower extremity strength while practicing proper lifting technique as well as safe body mechanics. And the subjective and objective measures that support this exercise are that the patient still complains of symptoms when lifting anything greater than 20 pounds. So we don't want to go over that limit with this exercise. And the patient also tends to bend their spine when lifting anything below waist level. So we want to practice doing that without bending their spine. And we're going to want the patient to perform this exercise and do 2 sets of 10 reps once a day while they're at home. And as far as precautions or safety considerations with this exercise, just want to make sure to keep the dumbbell close to you, and you want to make sure to keep your spine in neutral while you're doing the exercise. Okay? So to perform this exercise, you're going to hold the dumbbell vertically between your hands. You're going to spread your feet about shoulder width, a little more than shoulder width apart. Okay? And just point your toes out slightly. You want to keep it pretty close to your chest or to your body. Okay? What you want to do is bend at your hips and knees, keeping your spine neutral, and just squat down as low as you can without reproducing symptoms in your back, okay? And then use your legs to push yourself back up, okay? And you want to do 2 sets of 10 reps once a day, okay? And going forward, the prognosis for this patient should be pretty good. They've made good progress at the reevaluation. They're able to sit longer without having symptoms. They're able to lift up to 20 pounds without symptoms. Their range of motion has improved. And so they're making pretty good progress at the 2-week mark. As far as future restrictions, they may require a lifting restriction at work. In order to return to work, they may only be able to lift a certain number of pounds for a while. And they should be able, the goal is to finish up all their goals in the next 2 weeks. They should be able to meet that with continued exercise and physical therapy.